Yes.
All right. Let me turn up the volume. I can hear you, but the volume is a little low. Hello from London.
So, hello, Dr. Alexandrides. So, hello from Athens, Greece. So, I want to introduce Dr. Yannis. He is a board-certified plastic surgeon, and I think he's one of few who has practices in London, UK, and the US. He specializes and focuses on the face as I do, and he's been in practice, I think, 24 years, Doc?
25 years now. Yeah.
25 years. This is actually year 28 for me this week. So we both been around the block a little bit. Dr. Yannis was faculty at our Facelift Master Course 2.5 months ago. So I'm delighted to have you here. We can talk about this very important topic. And so do you want to say a couple of words before we go into our topics, Doc?
Absolutely. I mean, Dr. Kassir, is great to reconnect again. This is a great honor to have the chance to discuss this very hot topic of deep plane facelifts and neck lifts. As you said, it's been great that because we have collaborated before, we have worked together in these special techniques. You need no introduction, but you are one of the leaders in this specialized surgical technique that requires so much expertise and also attention to detail. We have this opportunity today to share with all the audience our experience and the differences that we see between European and American practice.
Perfect, and thank you so much. So we're going to go, I talked about the timeline a little earlier, so for all who are joining right now, please stay tuned. Let's cover the basics, and then we'll go right into questions at the very end. So we're going to start off with understanding deep plane facelifts. And first question is, what is a deep plane facelift? And we're going to talk about the surgical technique and how it differs from other approaches and the benefits of deep plane facelifts compared to traditional approaches. So I'm going to say a little piece, and I'm going to have Dr. Alexandrides, give his version, and then we'll move on to the next topic. So I will summarize a deep plane facelift as a surgical approach to lift and rejuvenate the face from here to here by going through a muscle layer called the platysma here, the SMAS here, and the temporal parietal fascia here, releasing ligaments to allow this muscle to freely and very tension-free reposition so you can get a better, refreshed, more rejuvenated look without looking done or operated on, or without looking windswept. So that's really the surgical technique. You have to go under this muscle here, here, and here, and it's technically more difficult than people know. And once you do that, once you learn this technique, and that's what we had a course on this 2.5 months ago, then you realize that there's just nothing better, and patients look amazing. Dr. Yanni, I'm going to hand it to you. What do you think about that?
Absolutely. Not only the patients look amazing, but the results last a very long time because, as you said, when you work in the deep layers of the face, you really reconstruct the face on how it used to be many years ago, and the structures remain where they need to stay. So the results last for over 10, 15 years. And the differences between before and after are stunning. A lot of times we have this saying about the mother-daughter effect, where someone looks after surgery like became the child of the patient. I have to say that it is one of the operations that really transformed facial rejuvenation. And we've been through this journey together where we started with more superficial type of facelifts. Well, just for the history for people to know, the original facelift was just lifting the skin. And although that looked good for a few months, the results would go back. And then we proceeded to SMAS application and SMAS elevation with better results and refinements that also give satisfactory results. But when you master the deep plane technique, then you can achieve results that are unparalleled to the other techniques and results that, again, last for a very long time.
So I agree with all of that, and not to make it too basic, but for somebody who's tuning in and doesn't have any surgical experience and anatomical experience, let me just at least go through the layers of the face so you guys can understand what we mean when we really talk about deep plane. So everybody has the same anatomy. Everyone has skin, and skin is about that thick. So you have the epidermis and then the dermis, which is the thick part of your skin. Under the skin, we have a thin layer of fat. Now, some of us have more fat, some of us have less fat. If you wait, you mainly gain the fat here, but some people get it here also. So you have skin underneath that layer. Then this is the key part. Underneath that fat, then you have a thin layer we call the SMAS here, but it's a fascial layer. Fascia is a thin muscle. It's not fat. It's a covering, right? So in the neck, you have what's called the superficial fascia that wraps around the muscle called the platysma, like that, this muscle, all right? And then face, it becomes very thin, and in the forehead, it's the muscle that you can raise your eyebrows with. So that layer is what we manipulate to get under that layer. So as Dr. Yannis just said, traditionally, people would just cut the skin, lift up the skin, just pull up on the skin. It looks great for a couple of weeks, couple of months, maybe 3 months, and then you realize that the skin is elastic and it doesn't hold. So that gives. And if you pull just skin over mounds of fat and muscle underneath, it looks off. It looks like somebody's had something done. The second procedure was now that you're on that muscle, you can just put a suture in it. And it also pulls a little bit, but just as Dr. mentioned, it doesn't last. But once you get under the third layer, that under the muscle here, under the muscle here, and under the third layer here, you can really release, pull the entire face where you want and where it used to be. And that's why I think the results are great. Underneath that layer is what we call the deep fascia that covers your muscles of facial expression, and that's where all the nerves and everything are. So people think, is this a more dangerous technique? It's a very safe technique because we know exactly where we are and we know where the nerves are and how to avoid them. If you randomly cut a piece of this smash out and put a stitch in it, that's I think where you get in trouble. Anything else that you think you want to add to that, Dr. Yannis?
Yes, I will. I just want to make a small note that the audio sometimes cuts off. I don't know if something you can do from your side for that. But yes, as you said, this is the technique that gives us so much liberty as surgeons to really go the length and to go to the maximum effect that we can achieve. And when I say maximum, I don't mean the overpulled effect. I mean the correction that is maximum, the correction that looks the best and the most natural. And I like to use my patients' older pictures. I ask them to bring portraits from when they were 20, 30 years younger in order for me to recreate this look for the patients who really are looking for this look. I have some other patients who also, on top of being rejuvenated, they want to change some aspects of the look. For example, some patients want to have a slimmer face or a more defined neck, and then we can do additional work with the deep plane. As we can take volume away, we can add volume in other places, we can lift, we can tighten, we can reduce protuberance. So it gives us the most freedom to achieve the best possible results.
And that's a key point that Dr. Yannis just mentioned is you don't want to look like anyone else. You want to look like a younger, better version of yourself. And that's why it's key to study pictures of you when you were 25, 35, and you see the anatomy, you see where the brows were, you see how you animate, how you sit and hold your face so we can kind of tailor the surgery. Is the audio okay, Doc?
Now Now it's better. Now no more interruptions. Yeah.
Great.
Yeah.
So a lot of questions are coming in, guys. I'm writing down all the questions that you're asking, and we'll address those in a second. So thanks for bearing with us. Dr. Yannis, you just mentioned something about your patients and what you talked to them about their previous photos. Can you talk a little bit about the criteria for ideal patients for deep plane facelifts and how important it is to address their expectations and outcomes?
Absolutely. So yes, so who needs a facelift overall is a person who has some aging signs of the face, and for most of these patients is also the neck. But usually it starts with the face, so we can start seeing some jowling. You can see deep nasolabial folds or marionette lines. You start seeing laxity of the skin and drooping. Overall, the face from being more oval in a younger age becomes more square and bottom heavy. And this usually bleeds into the neck, where we lose the definition between face and neck. And depending on the anatomy of the neck, you can have a pretty okay neck, or you can have a neck that really needs a lot of work, a neck without definition. On top of that, we have other changes. We have the loss of volume. So faces tend to shrink and to become more narrow, especially on the middle part. There is some imbalance between the two elements. Furthermore, on the brows, we can have drooping of the brows, which creates a heavy upper eyelid appearance. And furthermore, around the eyelids, we can see hooding, we can see eye bags, we can see deep lines under the eyes, and so on. I can talk for hours about the aging face, but these are the main points where we can address with a deep plane facelift. And in the broad term of the facelift, as Dr. Kassir explained earlier, we also liked, at least in my practice, and I know in yours, Ramtin, you like to include the brow and the neck, because these structures, if they're not addressed, sometimes they create a little bit of an imbalance.
And that's a really good point. So as you study your face, you know, people say this bothers me, it bothers me, but sometimes you really have to get the whole picture right, because like I tell patients, it's like painting two walls out of four in a room. You really have to get the whole thing right. And I agree with Dr. says that facial aging is all the things I just talked about. You lose volume and things start sagging and falling. Patients come in and they'll tell you, I hate my neck, or I look, and people tell me I look tired, but I slept all night, or I have bags under my eyes. Why are you so tired? This brow starts drooping, and no matter how much Botox or other things they do, it doesn't go back to where it used to be. You know, it starts bothering people. And at some point, regardless if you're now late 30s, 40s, it used to be 50s, now it's 40s, or even 60s, whatever you are, at some point it's going to bother you enough where you're going to say, I look in the mirror and I don't recognize the person, or I want to look as young as I feel. And that's when you call us and come see us. You know, we talked about the consultation process. We talked about addressing patient expectations and outcomes. So what I tell patients is just we sit in front of the mirror and we list, say, look, the deep lines here bother you, the jawline that you had is not as good, does the jowling, does the neck bother you? A lot of men, they don't want to wear a tie anymore, Yanni, because they see the neckband. So, you know, whatever bothers people, whether it's men or women or whatever the age range, we address that. And for me, when I started 28 years ago, the average age of somebody coming in for facial rejuvenation was about 56. Now it's 46. Now, how has that shaped in your practice?
It's very similar here in London as well. The average age has come down to the late 40s here. Occasionally, I see people in the 30s. There are some spatial patients. For example, we see more and more people who have lost a lot of weight. And we have the term Ozempic face, where because they have used medications perhaps, they suddenly lost a lot of volume, and that has created a saggy appearance of the face, and that can happen on a younger age. So overall, we see a tendency of people not to want to wait to age too much and then go for a facelift, because that obviously will be very visible. It will be a very, maybe a very big operation. We want people who want to prevent the aging signs from becoming too extensive, and they want to have the nice results earlier, and they want to maintain these results for longer. So they want to feel younger for longer.
So, you know, all valuable insight. So let's talk about the surgical procedure for a second. What we usually do, and depending on what you're doing, for us, we prefer sedation, meaning just like a colonoscopy. You put an IV in, you sleep just barely, breathing on your own and everything. You are, and then you wake up and you go home that same day, and usually we have nursing for you, and we have post-op facility if you don't want to go back to your home, or if you're from out of town or out of the country. If, in my practice, if you're also doing nose with all of this, then we do what's called general anesthesia. And that means, you know, you put to sleep fully and wake up after that. The time it takes to do procedures for us, so for us, a deep plane face and neck lift is about 2 hours. If you add the brow and the eyes, it's probably another hour or so, hour and a half. The nose is another hour, and lip lifting and leg lifting, that will probably be an hour. So it can take anywhere from 2.5 to like 5.5, sometimes 6 hours if you do everything, including laser and all that. The surgery is safe. In London and in New York City, you know, safety's first. So our back end team, physiologists, nurses, technicians that are making all this happen for you, we spend an inordinate amount of time. We obsess about your safety. So that is very, very important to us. And most patients don't even know about that and ask about that, but that is key. Like one of our post-op nurses in the operating room, she just celebrated 50 years in operating. So these people have a lot of experience. Would you pretty much echo that sentiment, Dr. Yannis?
Yes, absolutely. Safety is the number one preoccupation of my team, and my team, like yours, is the anesthetist, is the nurses who will do the follow-up, our patient coordinators who understand the needs of each patient. And as you said, we don't want to create the same results for everybody, but everybody has different needs, and we treat everybody as an individual with the specific necessities they have. So likewise, we like to do this operation as a day case. My patients will go home, even if the surgery is so comprehensive that it can go to 5 or even 6 hours, it is possible to go home. And this is because of the advances of the medications we use for anesthetics. They have become much safer, much less with side effects, so people recover without feeling nauseous, and they're happy to go home. We feel that recovering at home or at a location outside the hospital is safer because you have less chance of an infection, and it's usually more comfortable. However, I think we should talk a little bit about the post-operative care, which I think is as important as the operation, because the post-operative care is when our patients need us the most, and we have our teams there to look after them. Stitches usually come after 7 days out, so that's the time where we will start doing things like lymphatic drainage massage. We can propose LED light, which promotes healing and inflammation. We also use specific skincare products in order to accelerate healing. And that actually is appreciated by the patients, who most of them are really honor us to heal quickly and get back to their lives.
So the recovery is indeed very important. Patients or people are asking questions. So let's go right into that. What we usually tell patients, and let's see if you do the same. So we tell patients the same thing that we just did about the length of the surgery. If you can go home if somebody's with you. If you don't want to go home, if you don't want to burden your family or whoever it is that's with you, full complement of post-operative care. You can even stay in the facility overnight. We will come on you the next day and then tuck you in, and then you can go home with or without a nurse, or you can stay in our recovery facility. As Dr. Yannis just said, we do have methods like lymphatic drainage, hyperbaric oxygen, and all that will enhance your results. Now, that's because we're running out of time. I want to get to the questions. Differences. Somebody just asked, what's the difference between a vertical deep plane facelift and a deep plane facelift? So a vertical lift is once you're under the muscle, it's what direction you pull on the muscle that you release. So to me, when people talk about vertical lift, that's, I mean, it's some part of it is vertical, but that's more marketing. When your face doesn't age up and down, it ages down and forward. So what we pull is where everything goes easy. You see that everything has a vector that's easy. So if I pull vertically here, it looks weird, right? So when you're on each individual case, decide which vector that you want to pull. So everything else is just marketing, right? Dr. You want to comment on that?
Yes, so the vector is very important. It's something I discuss with my patients before surgery. And a true vertical vector doesn't really give good results. So on most people, there will be a certain vertical aspect. It's different from face to face, and it's also different from let's say, the expectations of the patient. So I really discuss this with the patients beforehand, and I explain to them what vector I'm going to use on different parts of the face, because by the way, you can have a different vector on the forehead, different vector on the face in order to get the right result. So great question. And yes, I mean, sometimes there are some buzzwords out there that create a little bit of more interest, but a vertical vector is something that means that we're not just pulling, because in the old style facelifts, most surgeons used to pull the face almost horizontally, and that would create some unnatural fold. We don't do that anymore, of course. So the vector, it has to be something between 30 to 45 degrees, depending on the face. Yeah.
So we talked about this. One of the questions is, can I get adjunctive procedures like a rhinoplasty, lip lift, endoscopic brow lift with my deep plane facelift? And that is absolutely. Let's quickly talk about this. People say I've done non-surgical treatments like fillers, other injectables, Morpheus, threads. Can I get a deep plane facelift? And the answer to that is yes. We advise you, if you know you're going to get a facelift, do not do any of these procedures leading up to it. Dr. Yannis?
Yeah, I agree. I think, first of all, adjunctive procedures are very welcome, and actually they enhance the result. For example, an upper lip lift is such a great operation to make someone look younger with minimal operative time and minimal recovery. So I usually encourage my patients to do all the facial procedures they need in one go, because that gives usually the best results, and also they take advantage of healing at the same time with all these procedures. Of course, after the medical clearance has been given. So, for example, upper and lower blepharoplasty is a very, very common combination with face and neck lifts. As you said, rhinoplasty can be combined as well, and fat injection is one of my favorites, because when you have a lot of volume loss, then you need to replenish that as well.
So I tell patients, it's a metaphor, but like furniture, sometimes you have to reupholster, which is the lifting, and sometimes you have to stuff the cushions again, which is the fat transfer that Dr. Yannis is talking about. How long is the recovery period after a deep plane facelift? What can I expect during the time? So I'll give my 10-second version. The first week, whether you have nose, laser, fat, and all that, the first week, you might be a little bruised, you have some tape on your face, you have a wrap on your face for a couple of days. The second week, sutures start coming out, you start really settling in, the swelling's starting to go away, and you're presentable. The third week is when you really are going to be socially kind of ready, and the fourth week, I say you're red carpet ready. Do you agree with that?
Yeah, that's exactly how I break it down. So I think the first week is the week that basically it's good to minimize all your social interactions. And then after the first week, which is the time when we have removed the stitches, most of my patients start using a little bit of concealer. They do the hair up and they start seeing people, but they're not ready. There's still going to be some swelling for most people. At the end of the second week is really when most people can fly back home, or they can go back to the office or meeting people face to face. A lot of my patients these days work from home. So for these people, after a week, it's mostly possible for them to go back to remote working as well. And also, I have become more and more flexible with letting my patients exercise and give them a very custom-made program on how to get back to exercise without waiting too long, because I don't find that they need to wait very long to recover from a facelift.
And again, it's individualized, but those are generally the guidelines. People want to know what type of scars will I have. So when you do the brow lift, it's in here. You don't see that incision because it's within there. On bald men that we do it, this fade have incisions inside your ear, in the crease, and behind your hair. Most of these incisions are visible for about 2 weeks. Stitches are coming out, and then the next 2 weeks they start fading very quickly. So I would say right out about a month, your incisions are really hard to see, and then at 3 months, if they're not completely gone, at least we in our office think about lasering them. What is your protocol for that?
Yes, we have a specific laser. It's called Advatec for scars, and we offer it to all our patients that need it. The truth of the matter is that when scars have been planted in the right position, they don't need lasers most of the time. But that's something that can accelerate the disappearance of scars. So it's all about the planning. It's how you identify in each phase the specific area where you're going to put your scar, and this is something that me and Dr. Kassir will mark before the operation very carefully, and it's not the same on every patient. It's different from face to face according to the anatomy of the face.
Absolutely. And so remember, we're plastic surgeons. We're not afraid to make these incisions, but if done correctly, under no tension, incisions and scars aren't the issue. But if you put them in the most hidden places and there's tension on the scar, you're going to see it, and it will advance over time, and you'll definitely see it. So that's key. Now, are there any kind of specific lifestyle changes or preparations I should make before undergoing a deep plane facelift? We tell people, imagine you're running a 10K, eat well, go on the vitamins. We all have protocols for it. Dr. Yannis does too. No drinking, smoking, vaping, partying, all of that. We don't mind if you do it. We still want you to do it a couple of weeks before and a couple of weeks after.
And I asked them to stop smoking, right? I'm sure you do the same, because I have to say that deep plane is more safe for people who have been smokers, because as there's less tension on the skin heals better. But still, I ask my patients to stop smoking before the operation.
Perfect. So let's see. We talked about follow-up care. Let's go over that really quickly. The typical age ranges. So to me, you need a deep plane facelift when you think it's your time, when it bothers you enough. It happens to be that the average age is 46. People say, can I get a deep plane facelift at 70? Absolutely. I mean, it's not the absolute age. It's how relatively I saw a healthy 75-year-old male yesterday. His arms look like Arnold at 75. So he, of course, he's healthy. Now you can be 55 and have high blood pressure and need to go get a medical workup first. So it depends on the person.
Yeah, I've done a deep plane facelift on a 35-year-old which had so much feeling in his face that he needed debulking, and he needed to have his face lifted up, and he looks extremely natural and very youthful. And then last week I had a patient who was 81 years old, but very healthy 81. So the absolute age is not so important. It's actually your health and how you have age on your face and how we can plan this facelift to be the best for you. I have to make one more comment on people who had previous facelifts. The Deep Plane Facelift will offer an improvement on the previous facelifts, and it's something that can be done very safely. However, what helps a lot is we have records of what type of operation you had and what techniques the surgeons use for you.
So this is an important point, Dr. Yannis. Revision facelifts. We all get revision facelifts a lot, and what you just said. So if you had a facelift that's fallen, didn't hold, they did a skin only, maybe they did a SMAS. The deep plane technique can all that, and it's as if you're getting a proper facelift for the first time and correct all of the things that you didn't get corrected all the time. And we both have a lot of revision patients. I do want to talk about something that Dr. Yannis and I went over a lot in our course, and that's what's the difference between an endoscopic approach, deep plane lift, versus an open lift. And the only difference is we can do an endoscopic approach from here. You don't have a ton of skin to resect and move, like push this up. If you don't have a ton of crowding here or a lot of extra skin that you can pull out, you can make an incision here, literally get under that muscle from using cameras, entire face, and bring it back. No incisions around the ears. If you do have a lot of skin here or you get a lot of bunching here, it's better to do the endoscopic approach this way, and then the rest of it so you can cut some.
Yes, I agree. And usually this endoscopic approach is better for younger people who usually don't have a lot of skin in excess, because if you do have a lot of skin in excess, it's not going to be enough. You will get some improvement, especially on the mid face and getting more of a high cheekbone appearance, and your nasolabial fold will become better, but the rest might not be completely corrected.
Exactly. And then after a can I still get injectables? Yes. You can still get Botox? Yes. You probably won't need as much injectables, but in specific areas you can do it. So remember, the key thing I want you guys to remember as we start concluding this live session is a lot of opinions exist out there, a lot of things. If you don't want to get a pulled or unnatural look, you have to seek out somebody that has a lot of experience in this lift. And you know, Yanni, that I think 40 or so attendees at our meetings, these are very good surgeons that came all over the States and all over the world. What they told us is that the anterior limit, meaning the extent of this deep plane and releasing those ligaments, was more than they even thought that they did or thought they could do. Once they did it, as if like, you know, they found the Holy Grail, meaning like, it's the same thing as now writing an email versus me writing you a letter. Once you do that, you can't go back.
It's true. It's true, because these ligaments are really the anchors that hold the skin and the face down. And no matter how much you pull upwards, if you don't release them, the face will always win. But if you release them, then you have this freedom to really do the best work you can, and the work that you will do, it will last for a very long time.
Somebody just asked a very good question, Megan from Texas. Is SMAS a waste of money? No, no, no. Please don't get the wrong impression. So other doctors who do SMAS facelifts and all that, the first thing I would do is look over the body of work that your surgeon has. If they do a certain technique and they get incredible results, go for it. That's what you want. That's really what you want. So technique is important, but you gotta like kind of put it all together. We've both done SMAS facelifts. We both done, you know, imbrications and plastic. We just happen to have our favorite, which is this deep plane technique. And in my case, I can apply it to a lot of the high percentage of my patients. So overall, your doctor has to get incredible, long-lasting results. They can call it whatever they want. What do you think about that, Yanni?
Yeah. No, I agree, and I think every doctor has eventually, from his experience, a technique that he likes the most, and he applies to his surgery. I would advise patients not to try to go against. So I think if you're going to a doctor, you have to trust your doctor or not trust your doctor. And if you trust your doctor, you have to let him do what he thinks is best for you, rather than trying to impose to him what you have heard from somebody else or from your friend. Because that can lead to problems. Pushing a doctor to do a procedure that he's not very comfortable with can lead to complications or to unnatural results.
Um, uh, so when they do threads, people ask all the time, is that going to preclude me from doing a facelift, or do they get in the way? They do get in the way. Most of them dissolve. If they don't dissolve, we have to go in there and take them out. So would I prefer you having nothing? That's just the easier dissection for us. Yesterday I did a facelift. She had a lot of filler in her face. Sometimes you get threads and fibrosis, and they've done Morpheus and everything stuck down. So technically it becomes a bit more difficult. But today there's hardly a person that hasn't had all those things. Are you seeing a lot of that in your practice?
I do, and I always ask them, and it's important to ask because some people forget in the years of their lives how many treatments they had, and they could have had thermals and fillers and then Botox, and each one affects the face in a different way. There are some treatments like Botox that really don't bother me at all, or a little bit of filler is okay, but if you have massive amounts of filler, or if you had multiple thermals and Morpheus, then it could be a challenge for the surgeon. And it's better for us to be prepared and to know what to expect rather than to face unpleasant surprise. Specifically about the threads, most of the threads doctors use these days are absorbable and usually take 6 months to absorb. So if you had a threading, I would wait a minimum of 6 months before performing a facelift.
So all very important. So let me kind of start wrapping things up and see if Dr. Yannis has any other things that he wants to add, and you guys give us your last couple of questions. This talk was about deep plane face and neck, which we think is an amazing technique based on sound anatomy and positioning the structures of the face that have either fallen down and descended, or you've lost volume. So you get under this layer, you reposition it where you want, treats the neck, the face, the brow, add some fat to cushion some areas that are hollow. You can also do eyes, adjunctive, nose, lip lift, laser with it. Recovery is relatively quick. A couple of weeks, you're back on your feet and doing your thing. And we've done it for a long, long time, and we look forward to seeing you guys. Dr. Yannis is in London. I'm in New York and New Jersey, so call us, text us, DM us, and we'll be happy to help.
Absolutely. And for us, the Deep Plane Facelift is really something that has revolutionized how we do facial rejuvenation. It has really given us a great ability to change really meaningfully a face, a neck, the whole appearance of somebody in a very natural and long-term way. And it's important when you come for a consultation, or, by the way, we offer remote consultations that you can have with Zoom or Skype. We would like to answer all your questions because it's all about the individual, it's all about what you want from this operation, and that's the best time to ask these questions.
Well, thanks everybody for joining. Thank you, Dr. Yannis Alexandrides in London.
Thank you.
I think this is helpful for everyone. Hopefully I'll see you in August sometime. And
absolutely, I'm waiting for you in London.
Have a great rest of your day, guys. But remember, the key is there's a lot of questions. It's a simple virtual consult away. Okay, so call us, and we'll be happy to spend a lot of time with you individually. Take care.
Bye-bye. Take care.
Bye, guys.